Hey everyone, if you've recently had a blood test for diabetes, you might be staring at a bunch of numbers and medical jargon, wondering, what does this all mean? Don't worry, I've got you covered. In this video, we're going to break down some important lab tests for diabetes and explain what they measure. Let's get started. The hemoglobin A1C test, or simply HbA1c, is one of the most common tests used to diagnose and monitor diabetes. It gives an average of your blood sugar levels over the past 2 or 3 months. So, what do the numbers mean? Normal numbers are when your A1C percentage is below 5.7% at around 6.5 millimoles per liter. Pre-diabetes range is from 5.7 to 6.4%, or 6.5 to 7.6 millimoles per liter. Finally, the diabetes range is above 6.4% of A1C percentage, and it increases in severity as your percentage of A1C gets higher and higher. So, exactly what does the A1C test measure? It looks at how much sugar or glucose is attracted or attached to your red blood cells. Since these cells live for about 90 days, this test gives us an overall picture of how much sugar has been in your bloodstream over time. The higher the percentage, the more glucose is sticking to your blood cells, and thus the more sugar is in your blood. Pros and cons of this is that pros are you don't need to fast for this test. So you can eat right before you take it, and it gives long-term trends rather than a immediate assessment of your blood sugar levels. Cons is that this could be inaccurate for people with blood disorders such as anemia or other blood disorders. The second test we're going to be looking at is the fasting glucose test. So, the fasting glucose test measures your blood sugar levels after you have not eaten for at least 8 hours. So, that's the fasting part of the test. It is typically performed in the morning before breakfast, right after you sleep, because you don't eat during your sleep. For fasting blood sugar levels, there are three sort of stages as well. For the normal stage or without diabetes, your normal levels would be below 5.6 millimoles per liter. The pre-diabetes stage is when your fasting blood sugar level is 5.6 to 6.9 millimoles per liter. And finally, above 7.0 millimoles per liter, you're now into the diabetes stage. This test measures the amount of glucose in your blood after an overnight fast. So, without food intake, your body's glucose level should be regulated by insulin. And as a result, if your blood sugar level remains high or elevated, it may indicate insulin resistance or inadequate insulin production, as you haven't eaten anything in the past 8 hours, but your blood sugar is still high. So, some of the pros about this test is that it's simple and widely used for diabetes screening. Cons are that it requires fasting, although this can be combated by just taking it in the morning right after you sleep. And additionally, results also can vary based on stress, illness, or recent sleep patterns. The third test we're going to be looking at is the random glucose test. The random glucose test measures blood sugar levels at any time during the day, regardless of when you last ate. It's often used when symptoms of diabetes, such as excessive thirst or frequent urination, are present. So, what do these numbers mean? So, you're basically going to take a little finger prick test here, and it's going to pop up one of these numbers. So, a normal level of random glucose would be less than 5.6 millimoles per liter. A fasting blood sugar from 5.6 to 6.9 millimoles per liter indicates pre-diabetes, and above 7 millimoles per liter, two separate tests would mean diabetes. So, unlike the fasting glucose test, the random glucose test provides a snapshot of your blood sugar levels at any given time. A very high reading, especially in the presence of symptoms, may indicate diabetes and should be confirmed with additional testing. Pros of this test is that it's very fast and it does not require fasting. Cons are that it's less reliable for diagnosis, as blood sugar can fluctuate throughout the day due to recent meals, stress, or physical activity. The last test we're going to be looking at is the 2-hour glucose tolerance test. For this test, you consume a sugary solution after fasting for approximately 8 to 12 hours prior to the test. And then, after you consume this glucose or sugar solution, your blood samples are measured and tested for your blood sugar levels 2 hours later. It helps determine how well your body processes glucose. So, what do the numbers mean? So, normal levels are when your 2-hour glucose test is below 7.8 millimoles per liter. Pre-diabetes is when it's from 7.8 to 11 millimoles per liter, and above 11.1 millimoles per liter indicates diabetes. This test evaluates how efficiently your body clears glucose from the bloodstream after ingestion. And if your blood sugar remains elevated after 2 hours, it suggests that your body isn't effectively using insulin to manage glucose levels. Some of the pros of this test is that it's very accurate in detecting prediabetes. However, some of the cons are that it's time consuming, requires fasting, and also requires multiple blood draws to have multiple test results.
Next, let's look at other possible tested biomarkers. First off, we have creatine. Creatine is a waste product formed from the normal breakdown of muscle tissue. It is filtered out of the blood by the kidneys and excreted into your urine. A lot of blood creatine levels, elevated levels, can indicate impaired kidney function, which is a common complication of diabetes. Cholesterol, which has LDL and HDL. LDL, or low-density lipoproteins, carries cholesterol to tissues, including the arteries. High levels can lead to plaque buildup, increasing the risk of cardiovascular diseases. High-density lipoproteins transport cholesterol away from the arteries into the liver for removal, and higher high-density lipoprotein levels are generally protective against heart disease. Triglycerides, these are a type of fat or lipid found in the blood. Elevated triglyceride levels can increase the risk of heart disease, and this is more prominent in individuals with diabetes who often have higher risk of heart diseases. Next, potassium. Potassium is an essential mineral that helps to regulate fluid balance, muscle contractions, and nerve signals. Abnormal potassium levels can indicate kidney issues, which are common in diabetes. ALT, alanine aminotransferase, is an enzyme found primarily in the liver. Elevated ALT levels can indicate liver damage or inflammation. In individuals with diabetes, high ALT levels may suggest non-alcoholic fatty liver disease, which is a condition commonly associated with insulin resistance. Insulin. This is a hormone produced by the pancreas that regulates blood glucose levels by facilitating the uptake of glucose into cells for energy production. Measuring insulin levels can help assess how much insulin the body is producing and can aid in distinguishing between type 1 and type 2 diabetes. C-peptide. This is a byproduct of insulin production. It is released in equal amounts to insulin. Measuring C-peptide levels helps evaluate pancreatic beta cell function and insulin production. So low C-peptide levels are typically seen in type 1 diabetes due to autoimmune destruction of beta cells, while normal or high levels may be seen in type 2 diabetes, reflecting a level of insulin resistance. Albumin. This is a urine test that detects the presence of albumin, a type of protein, in your urine. Normally, kidneys prevent significant amounts of albumin from entering the urine by filtering this protein out. However, in diabetes, kidney damage can lead to increased urinary albumin excretion. This may be an early marker of diabetic nephropathy or kidney damage caused by diabetes. Pancreatic antibodies. These are autoantibodies directed against components of the pancreas, such as the islet cells, glutamic acid decarboxylase, and insulin. The presence of these antibodies indicates an autoimmune response against pancreatic beta cells, leading to their destruction and possibly the development of type 1 diabetes. You may see more or fewer results on your blood test depending on what your doctor ordered. Lab tests have natural variations. Understanding your results is the first step to managing your health. I hope this video helped you understand your lab test results. If you found this helpful, give it a thumbs up and share with someone who might need it. Stay informed, take charge of your health. See you in the next video.